Today, the United States surpassed 300,000 deaths from COVID-19. Officials say there are likely many more to come before the pandemic is over. But there is renewed hope as the first doses of Pfizer's COVID vaccine roll out all across the country. Vaccinations started this morning in several states. Joe Hankey is tracking when the first shots could happen here in Atlanta.
More than 5,000 doses of Pfizer's COVID-19 vaccine arrived along Georgia's coast today, and a spokeswoman with the Georgia Department of Public Health tells me they aren't expecting any shipments from the pharmaceutical company to arrive in Atlanta until Wednesday.
A simple white package arrived at Georgia Department of Public Health's coastal district offices today. To the staff awaiting its arrival, it's a symbol of hope.
This is unbelievably exciting. We've been dealing with this since January or February and looking for a light at the end of the tunnel.
Dr. Lawton Davis is the director of the Coastal Health District. He says the 5,850 doses will be used to vaccinate healthcare workers on the front lines and people in long-term care facilities in Chatham, Glenn, and surrounding coastal counties. Davis said a few healthcare workers would be vaccinated today. Governor Brian Kemp and State Health Director Dr. Kathleen Toomey will travel to Savannah tomorrow as vaccinations ramp up. A State Health Department spokeswoman tells 11 Alive no additional shipments from Pfizer are expected in Georgia on Tuesday, but shipments are expected in Atlanta on Wednesday. The state also expecting the FDA later this week to authorize a second vaccine from Moderna, and shipments from Moderna could arrive next week.
But we do know that some of the symptoms of the vaccine, things like fatigue and headache and muscle aches, are also symptoms of COVID.
Dr. Mary Beth Sexton with Emory University's School of Medicine says those vaccine side effects typically only last 24 to 48 hours. Respiratory issues, though, are not an expected side effect.
They don't include respiratory symptoms. So people who've been vaccinated shouldn't have side effects like cough and congestion and shortness of breath. So we've let people know if they have any of those, they really should be evaluated for COVID.
And Dr. Sexton also says it's a good rule of thumb. Don't schedule anything important until at least 24 hours after you receive your vaccine. That way, if you do develop any side effects, you can easily monitor them from home.